Hello, this is Dr. Saldivar again. Today we're looking at Chapter 12 of Feldman's text, Essentials of Understanding Psychology. Chapter 12 is on the topic of understanding psychological disorders. Now, in psychological terms, abnormal behavior is when someone acts, thinks, or feels in ways that are significantly different from other people in similar situations. To boil that down, abnormal behavior we can think of in a shorthand or abbreviated kind of way as someone behaving in a way, reacting to things, thinking about things in a way that is abnormal, not normal, that is different from how others may react. That's really just what it boils down to. Now, to figure out if a particular behavior, situation, belief is abnormal, psychologists look at a few criteria. First, what's considered normal in that person's culture. Someone may have a belief that in your culture seems strange, unusual, weird, but in their own cultural setting, it may not be seen as a strange or an unusual or abnormal thing. For how long has that condition existed? Is it a recent development, or has it been something that that person has believed, felt, been doing for a long period of time? How much is the person's life affected on a regular basis by the behavior, the belief? If you have a belief that others, psychologists or not, find to be unusual, abnormal, that's one thing. But if that belief, that behavior is something that significantly affects your quality of life versus something that doesn't really have much of an impact, that's a significant matter that psychologists would have to factor in when they're trying to consider whether someone needs some kind of treatment or intervention, or just to try to understand exactly what is or is not abnormal about a person's particular belief, behavior, attitude. Because of this, there's not a clear line between normal and abnormal. It's more like a range or a continuum. Some behaviors might be thought of as unusual or eccentric on one end of the spectrum. Others could be extremely troubling, could be dangerous to a person or to others. Obviously, that would be a situation where there'd be a bigger concern on the part of the psychologist. Also, we have to acknowledge that what one psychologist might call abnormal might change depending, again, on where and when someone lives. Our ancestors had beliefs that we today might find very objectionable, very to be a problem for us. But in a different time or place, I'm not saying those beliefs may be okay or correct, but they were more commonly held by more people, and so they would not, in that time and place, have been seen as abnormal. For this reason, it's important for psychologists to take into account these cultural differences. Again, you're not necessarily judging the behavior, the attitude. You're not saying it's okay or it's not a problem. You're trying to determine in an individual's context, their own particular time, place, setting, how is this affecting them? How widely is that belief shared? How long has that belief or attitude or behavior been in existence? All these things need to be considered before any kind of treatment plan or intervention can be considered. Now, the Diagnostic and Statistical Manual of Mental Disorders, or DSM, is published by the American Psychiatric Association. And for you psychology majors that are watching this, I want to be clear because this is often a source of confusion. Psychology majors will hear about the DSM over and over again in many different courses as a psychology major or psychology minor. It's important to keep in mind that there are two APAs in the U.S. that psychologists have to think about or be concerned with. One is the American Psychiatric Association. That's one APA, and they publish the DSM. Psychiatrists, as you probably know, are medical doctors, MDs, or DOs, sometimes doctors of osteopathic medicine, who specialize in mental illness, mental health, and related disorders. The American Psychological Association is another APA, and that's the professional association for the psychology profession. So, for example, again, psychology majors or even some people taking psychology classes, if you have to write a paper or report in APA format, that is the American Psychological Association, that APA. The other APA is the one that creates the DSM, and they're two different separate organizations. I don't want to get us bogged down in details, but I feel like I should mention that Again, especially for psychology majors, psychology minors, because you're going to see this over and over again in your classes. But let's stick now with the American Psychiatric Association, that APA, and the DSM. The DSM is used for the classification of mental disorders. It provides what we think of as a common language or a common set of criteria, standardized criteria, for the diagnosis of mental health conditions. The DSM lists about 20 major categories of mental disorders. These categories encompass a wide range of mental health conditions, and they all have their own specific diagnostic criteria, characteristics, descriptors. A few examples from the DSM, just to give you some idea. There's one category for schizophrenia and other psychotic disorders. These are characterized by delusions, hallucinations, disorganized thinking and behavior. So in a nutshell, seeing things, hearing things perhaps, or both, that are not there. Bipolar and related disorders. These are characterized by episodes of mania, possibly sometimes accompanied by depression. We have another category, trauma and stressor-related disorders. These result from exposure to trauma, traumatic events that we may experience that cause, as an example, PTSD, post-traumatic stress disorder. Depressive disorders. These will present persistent feelings of sadness, emptiness, loneliness, irritability, such that someone's daily functioning is really being affected. A lot of times, because of things in the world, things happen to us, certainly all of us will feel sadness or irritability or other the same similar feelings, emotions. But it's one thing to be sad for a couple days because a beloved family member died or something like that. If you are persistent in feeling sadness, loneliness, emptiness, etc., then that suggests that you may have a more serious issue, a depressive disorder. Anxiety disorders are characterized by excessive fear, including different kinds of phobias. Separation anxiety is one common example. We also have generalized anxiety disorder. And then final example, and again, there are many others that you can see in the reading, dissociative disorders. These are characterized by disruptions in memory, identity, emotional state, perception. Disassociation literally means feeling separate from, apart from yourself. So these are cases where people have what might be called blackouts. They do things, they behave in certain ways that are troubling or abnormal, and then they don't have memory of them because they've disassociated. They're performing actions or doing things that they don't have any conscious control over, or at least not a conscious memory of after they're completed. Let's review the major ideas then from this chapter. So again, abnormal behavior is when someone acts, thinks, or feels in ways that are significantly different from others in the same context or similar situations. There's not a clear line between normal and abnormal. It's more of a range or a continuum. And then finally, the Diagnostic and Statistical Manual of Mental Disorders, or DSM, a publication of the American Psychiatric Association, is a publication that is used in the profession both on the psychology side and on the medical side, psychiatric side, as the starting point for the classification of mental disorders. That concludes this overview of this chapter in the Feldman text. I hope you find it helpful as you prepare to read the chapter yourself. I will see you next time in class. Good luck.